Should I worry about lumps in my breast? Let me share with you some thoughts on that subject. One of the questions that I'm always asked about are, Dr. Harness, what do I do about all these lumps in my breast? This is particularly true of younger women. And one of the difficulties is that people, with all the conversation about the risk of breast cancer, somehow think that every lump in the breast is potentially a cancer. Now, in women in their teen years and 20s and well into their 30s who are not overweight, the fat envelope, the layer of fatty tissue that's around the breast tissue, should be thin as long as a person is not overweight. And with that thin layer, you can then easily feel the normal glandular tissue underneath the skin of your breast and underneath that thin fat envelope. And certainly for teenage women, women in their 20s, women in their 30s, and actually women with fibrocystic changes in their 40s, the breast can feel quite lumpy. So what's important here? What's important is knowing your breast, being aware of your breast, particularly just before your menstrual period and then after the hormone stimulation goes away after your period. If there's a persistent lump in the breast, particularly one that feels as hard, let's say, as a marble, then something like that needs to be evaluated, particularly if it continues on for a month or more, well after your period or through 2 or 3 cycles. Clearly such a lump needs to be evaluated. In younger women, the typical way of evaluating such lumps is not only a physical examination by a physician, but very importantly with breast ultrasound. We generally don't like to do mammograms unless women are in their late 30s or, of course, into their 40s, and particularly for younger women where these lumps are typically a fibroadenoma, a benign little tumor of the breast, we certainly don't want to be doing mammograms. So the answer is, if a lump persists through certainly more than 1 or 2 menstrual cycles, you need to have it checked out. If you're younger, please make sure that your physician is ordering an ultrasound. Mammograms may be indicated in women in their late 30s or well into their 40s, or, of course, or 50s or 60s. Certainly not all lumps are cancer, but if there's a concern, it needs to be evaluated. Do you know that not every breast cancer patient needs chemotherapy? Now there's a way to decide if chemotherapy will benefit you based on the unique biology of your tumor. To learn more about the Oncotype DX test and how to discuss it with your doctor, click this button.